Hi everyone, and welcome to our additional media offering with the Maine Health Center for Tobacco Independence Training and Education team. For this quarter's Soundbite, we're going to be talking about second and third-hand smoke and the dangers associated with both. I'm going to give a brief introduction to second and third-hand smoke, discuss the health problems associated with each, how we can protect individuals, and then talk a little bit about prevention. So let's start off talking a little bit about what secondhand smoke is. Secondhand smoke is a combination of two things. First is the smoke exhaled from the lungs of someone who smokes, and second is the smoke that drifts from burning tobacco and vapes. Secondhand smoke contains more than 7,000 chemicals, hundreds of which are toxic and about 70 can cause cancer. Secondhand smoke is a significant public health concern. Annually, secondhand smoke is estimated to cause approximately 53,800 deaths in the United States alone. While the public health impacts of smoking and secondhand smoke exposure are well documented, the concept of third-hand smoke is a relatively new area of study in public health. So, what is third-hand smoke? So third-hand smoke is made up of the pollutants that settle indoors and outdoors as well when tobacco is smoked. The chemicals in third-hand smoke include nicotine as well as cancer-causing substances. Third-hand smoke builds up on surfaces over time. It can be embedded in most soft surfaces such as clothing, furniture, curtains, bedding, and carpets. It also settles on hard surfaces such as walls, floors, and in vehicles. Third-hand smoke can remain for many months even after smoking has stopped, which is why it's becoming more recognized as a potential danger, especially to children who are not only inhaling the chemicals released by the residues, but they also ingest the particles that get on their hands after crawling on floors or touching walls and furniture. It's important to note that third-hand smoke cannot be eliminated by airing out rooms, opening windows, using fans, or confining smoking to only certain areas of the home. Regular household cleaning often cannot effectively remove third-hand smoke from many surfaces. Though research has clearly shown that secondhand smoke causes many health problems, the effects from long-term exposure to toxins in third-hand smoke are not as well studied. So research has shown that indoor smoking raises the risk of exposure to harmful chemicals and that ventilation and cleaning cannot adequately eliminate these hazards. So now that we've had a brief introduction to second and third-hand smoke, let's go into some more specific information on secondhand smoke. So maybe you're wondering who's affected by secondhand smoke. Secondhand smoke can cause health problems in anyone who's exposed to it, even if it's just for a short amount of time. This means adults, children, and even pets. So most people are exposed to secondhand smoke in their homes or the places that they work. People may also be exposed in public places like bars, restaurants, and casinos, as well as in their vehicles. So there's no risk-free level of secondhand smoke exposure. Even brief exposure can be harmful to somebody's health. So some of the health problems that come along with secondhand smoke, specifically in adults, are heart disease, lung cancer, and stroke. And because their bodies are still growing, infants and young children are especially vulnerable to health risks from secondhand smoke. Some of these health problems include middle ear disease, respiratory symptoms, and even sudden infant death syndrome. And that's just to name a few. So, according to the CDC, since 1964, about 2,500,000 people who do not smoke have died from health problems caused by secondhand smoke exposure. Although this number is quite astounding, there are now more communities and states that are adopting smoke-free laws, which in turn has led to the number of adults exposed to secondhand smoke in public places like work sites, bars, restaurants, and casinos to actually decrease. So I'd previously mentioned that pets are also affected by secondhand smoke. I wanted to add here that the risks associated with smoking in pets aren't confined to just dogs and cats. So for example, studies have shown that birds, are at risk, and fish as well. So now that we've talked about secondhand smoke, let's talk about who's affected by thirdhand smoke. Thirdhand smoke affects both adults and children who live in homes, hotels, any indoor environment, even cars that was used long-term by people who smoke. There's numerous health effects of thirdhand smoke in children. In fact, according to the Mayo Clinic, children are the most vulnerable to health effects because they're more likely to be touching surfaces and putting objects near their noses and their mouths. So children exposed to thirdhand smoke at home are more likely to have asthma, ear infections, frequent illnesses, and even pneumonia. I also wanted to mention that along with secondhand smoke, thirdhand smoke can also affect pets. So like children, dogs and cats spend a lot of time on the floor, which is where tobacco smoke residue lingers, which can then get on their fur. So dogs, cats, and children not only breathe these harmful substances in, but pets can also ingest them by licking their fur and even their owner's hair, skin, and clothes. So I'm not sure about you, but I can imagine many people would be astonished to hear how smoking can affect their pets. So now that we've talked about who is affected, let's talk about some of the disparities relating to second and third-hand smoke. Although the number of people who do not smoke but are exposed to secondhand smoke has declined, disparities in secondhand smoke exposure continue to persist. So these groups include non-Hispanic Black Americans, people who live below the federal poverty level, those who are working in like traditionally blue-collar industries, so like service occupations or even like construction, people who live in multi-unit housing, as well as children 3 to 11 years of age. So just like secondhand smoke, disparities in third-hand smoke exposure also exist. People who live in rental homes or apartments are at a higher risk because these properties change occupants so frequently, and smoking bans often do not apply to private spaces such as homes. Children who live in apartments show a higher level of exposure to tobacco chemicals than children who live in detached housing, even when they're not exposed to secondhand smoke. So these children may be exposed to third-hand smoke from previous tenants who smoked in the home, or from the smoke of neighbors that enters their home through like windows, air ducts, or other routes. In order to protect these disparate populations from second and third-hand smoke, promotion of smoke-free policies and statewide laws that prohibit smoking in workplaces and public places are critical to protect non-smokers from this preventable health hazard. So how can we protect children, family, and friends from second and third-hand smoke? Along with the policies just mentioned, there are also steps you and your friends and family can take to protect yourself and your loved ones from secondhand and third-hand smoke exposure. According to the CDC, some ways we can help protect people from secondhand smoke is to first make your home and vehicles smoke-free. Second, if you do smoke cigarettes, consider looking into ways to quit, including medication like nicotine replacement therapy, coaching and counseling, as well as texting-based support. More options for quitting can be found on our website at ctimaine.org, which I will also link at the end of the episode. Furthermore, if you or a loved one smokes, you can support them by quitting and encouraging them to quit and being that support system for them. You can also make sure your child's school is smoke-free inside and out. And lastly, you can talk to your employer about the benefits of a tobacco-free policy in your workplace. So what about third-hand smoke? How can we limit exposure? A 2010 study called When Smokers Move Out and Non-Smokers Move In, Residential Third-Hand Smoke Pollution and Exposure, indicated that third-hand smoke accumulates in smokers' homes and persists even after the homes have been empty for 2 months and are cleaned. This study also specifies that there's not much that can be done in terms of cleaning third-hand smoke in affected places. Recommendations to minimize potential negative health effects by the National Environmental Health Association are to avoid any indoor environment that was used long-term by individuals who smoke. Insist that people who do smoke go outdoors and don't smoke in homes or cars. While research still needs to be done on how to clean up third-hand smoke, it is best to simply avoid any indoor environment that was used long-term by people who smoke. So to wrap up, let's talk about some key points regarding both second and third-hand smoke. First, it's important to remember that there is no risk-free level of secondhand smoke exposure. Second, widespread smoke-free policies are an important way to help prevent secondhand smoke exposure. Studies show that adoption of smoke-free policies reduces secondhand smoke exposure, reduces smoking, and encourages people who do smoke to quit, helps prevent smoking initiation, and results in high levels of compliance in the state or community in which the policies are applied. Another point that I wanted to reiterate is that adults, children, and pets are all affected by both second and third-hand smoke. Lastly, if you do smoke and need help quitting, look into your state quit lines or talk to your doctor about your options. So before we end today's episode, I did want to connect a few dots to some of the great work that is happening in Maine, along with some great resources. Under Maine law, indoor workplaces, restaurants, bars, outdoor dining areas, state parks, beaches, and common areas of multi-unit housing complexes and other indoor public places are required to be smoke-free. As of October of 2015, Maine law also prohibits the use of electronic smoking devices, such as electronic cigarettes and vaporizers, in all indoor public places. I'm going to link a couple of great resources related to Maine laws in the description, as well as at the end of the episode. I also wanted to mention the Smoke-Free Homes Pledge that is located on our website. By taking this pledge, you are committing to keep your home smoke-free and making your family and home healthier by removing secondhand smoke. I will also link the website in the description as well as at the end of the episode. So to end off, I want to thank everyone for tuning in and listening to this soundbite about second and third hand smoke. I'd love for you to think about some of the takeaways from today's conversation, and if you have any questions, please don't hesitate to reach out to our training email at tobaccotrng@mainehealth.org. I hope you enjoyed today's conversation, and if so, make sure to visit our website at www.ctimaine.org for the recording and to stay up to date on future episodes. Thanks, everyone.